Yep.
Okay, I'm gonna come in, I'm gonna wash my hands. Hi, I'm Annie Mason. I will be your nurse today. Can I get your name and date of birth, please?
Rebecca Mason, 2/20/97.
Good, okay. Today we're just gonna be performing a general health assessment on you, just make sure everything's okay. You can do that just sitting in that chair right there, so that's good. I'm gonna provide some privacy. And what is your reason for seeking care today?
Just an annual physical exam.
Okay, good. And so are you currently pretty healthy? Nothing else going wrong with you at all? Everything's good?
Yeah.
Okay, good. Do you have any current medical conditions?
No.
So you're not on any like current medicines, anything like that?
No.
Are you allergic to any medicines at all?
No.
And then no medical treatments, no breathing treatments, dialysis, nothing like that?
No.
Good, so overall pretty healthy, that's good. Okay, so now we're just going to talk about some past health history. Did you have any childhood illnesses at all?
No.
Any like prior surgeries, hospitalizations, anything like that?
Nope.
And then are you up to date on all your immunizations that you have?
Yes.
And then did you get your flu shot this year?
Yeah.
Good, awesome. So now we're just going to talk a little bit about your personal history. You said you're a student. Do you live in the dorms then, or you live at home?
I live at home.
Who do you live with at home?
I live with my mom, my sister, and my dad.
And you feel safe in your home?
Yes.
Good. And all those relationships are good?
Mm-hmm.
Good. And then what about like your diet and nutrition? Is your appetite pretty good?
Yep.
You eat breakfast, lunch, dinner?
Uh-huh.
Not trying to gain weight, lose weight, anything like that?
Nope.
All right, good. And then how about your mental health? I know you said that you're a student. I'm sure you get stressed sometimes. Do you do anything to cope with that?
I like to read books and like exercise sometimes.
Good. Those are all really good habits to get into. So that's good. You sound pretty healthy. And then the last thing we're going to talk about before my assessment is just your personal habits. So do you use any tobacco at all?
No.
No smoking?
No.
Good. Any alcohol?
Yeah.
About how many drinks per day?
1 to 2.
Good. And then any illicit drug use?
No.
Good. And then you mentioned you like to go on walks and stuff.
Mm-hmm.
How often do you do that?
Like 5 times a week.
Good. That's really good. And then do you do any self-exams, like any self-breast exams, any skin exams?
No.
Okay, well, maybe we can talk about that later. Those are all really good preventative measures to take. And then just what about your oral hygiene with your brushing and flossing? What's your routine with that?
I don't floss, but I brush my teeth twice a day.
Good, good. And then what's like the date of like your last physical? Has it been
a year, last year.
Last year, so you got all your blood pressure taken and everything was normal?
Yep.
Great. Okay, so I'm going to go ahead and start my assessment. I'm just going to go ahead and just look at your general appearance here. Your skin is nice and pink and pale, and it feels nice and dry, moist where it should be, really appropriate for your ethnicity. The hair is nice and evenly distributed everywhere. I do notice some little lesions here. Did you fall or get scraped or something?
Yeah.
And that looks like it's healing nicely.
Mm-hmm.
Just notice some other little spots. All those have been there, and your freckles, moles, that's all stayed the same.
Yep.
I do notice another little mole on your face. Has that always been there?
Yeah.
Not changing at all, color?
Nope.
Nothing?
Nope.
Good. Then your skin triggers about 1 to 2 seconds, so that's great. And then, so the next thing I'm going to do is look at your hair and your scalp. Your hair is nice and thick. I don't notice any balding at all. Your scalp is nice and pale. Don't notice any dryness. That's really good. The hair's really evenly distributed. Texture's really smooth, so that's all really good. And then your body hair, like your leg hair, your arm hair, is all evenly distributed, like I said, so that's also great. Then I'm just going to take a look at your nails. I don't notice any clubbing at all. Good. They're nice and pink and clear, short. I'm noticing about a 2-second cap refill, so that's really good. They're nice and thick, your nails. Didn't notice any artificial nails. And then I'm gonna inspect your head one more time. I don't notice any bumps or like masses, so that's really good. And your head sits really nice on your shoulders. Everything is symmetrical. All your facial structures, your eyes, your nose, your ears, everything sits really good and symmetrical on your head. You got good range of motion? Move your head up and down. And nothing sore at all? That's all good? Okay, good. And then can I just have you smile? Good, okay, I noticed a dimple. No sagging or anything like that, so that's really good in your smile. And then now I'm just gonna go ahead and check your vision. So first I'm just gonna inspect your external ocular structure. So your eyebrows look really good, your eyelashes, the hair is distributed normally, your eyelids are symmetrical, the skin looks good. I don't see any discharge, anything like that, so that's good. I'm gonna look at your conjunctiva. Those are nice and pink and moist. Don't, again, notice any discharge, anything like that. No drainage, no lesions, so that's really good. And then now I'm just gonna look at your sclera, your cornea, your iris, and your pupils. So can I just have you look this way, and again this way, up, down. Okay, your sclera is really white, that's good. Your iris is blue, both of them are round and equal, good size, no abnormalities there. Your pupils are really good and round. I'm gonna say they're about a 6, so that's normal, all expected. So now I'm just going to perform a couple tests. The first test I'm going to do is to see your pupils react to light. So typically I would dim the lights, but I'm not going to do that today. I'm just going to shine a light into your eyes and just see them react. They'll just be in just for a little bit. Okay, good. Good. And they both react totally normal, so that's great. Then I want you to just follow my pen light with both of your eyes. Good, so no accommodations there. And then I'm just going to check your 6 cardinal fields of gaze, so I just want you to follow my pen light again one more time. Good, so I didn't notice anything there either, so that's all great. Okay, so now I'm just going to check your ears. Just again, they're aligned and positioned really good on your body. Nothing's abnormal there. I'm going to go ahead and just feel them. Good. You're nice and warm. They're both intact. I didn't notice any discharge or lesions or anything in here, so that's really good. And then typically I would look into your ear and look at your tympanic membrane, but I don't have the tools to do that today, so I would normally like to see a normal pale gray color, so that's what I would expect to find, and I don't notice anything today. So I'm going to perform a couple hearing tests. First, I'm going to do the whisper test, so I'm just going to, for the sake of time, I'm just going to do it on one side, but normally I would do it on both. I'm going to whisper a couple words, and I just want you to repeat those back to me.
Okay.
Baseball book.
Baseball book.
Good. Okay, so that was good. And then I'm going to go ahead and do the Weber test, but I'm just going to explain that to you today. I don't have the tuning fork, so I'll just explain it to you. I would hit the tuning fork against my hand, and it'd vibrate. I'd put it on my patient's head, and I would ask her to let me know if she hears it equally as loud in both ears, or if one ear is louder than the other, which would indicate some hearing loss. So we want it to be equal in both ears. So I don't notice anything with your ears, so that's really good. The next I'm going to look at is your nose and your sinuses. So your nose, the general appearance is really good. It's nice and symmetrical. Your nostrils are both open, good, symmetrical. Don't notice any discharge. Haven't had any drainage at all. No, good. Your nasal passages seem clear. I don't notice anything up there. That's good. I'm just gonna feel for any tenderness. No tenderness there?
No.
Okay, I don't notice any swelling, so that's good. And I'm just gonna do one more time. Okay, so good. So no, nothing in your sinuses or anything either, so that's really good. Okay, so now I'm going to, yes, you put your glass on, sorry. I'm gonna look at your mouth and your oral pharynx. So your lips, the color's really good, nice and pink, dry, don't notice anything there, not chapped, nice and smooth. And then can I get you to open up, smile, put your tongue out, please. Can I say ah? All right, so your teeth are nice and aligned and stable. Your gums are nice and moist and pink, smooth. Didn't notice any abscesses there at all. Can I just get you to move your tongue? No problems there at all?
No.
Okay, your tongue was also nice and pink. Your buccal mucosa and then your anterior and posterior pilar were both nice, pink, moist. Everything's really good there. Your uvula, your tonsils, everything's smooth, pink, and moist in your mouth. So, and your tongue had good movement. That was great. Okay, and then the next thing I'm going to look at is your neck. I already looked at the skin and stuff. So, your head sits good on your shoulders. You got nice range of motion. Good. I'm just going to go ahead and feel your thyroid and your lymph nodes. All right, so your thyroid and lymph nodes, the size was really good for both those, the shape. No tenderness at all in any of those areas?
No.
Good, okay, and I didn't notice any nodules or anything like that, so that was good. And then I'm just gonna feel your tracheas. Yeah, so all your structures in your trachea, everything's nice and aligned and expected. Didn't notice any lumps or any masses anywhere on the neck. Didn't feel any. Okay, good. So your neck looks great. And then, so now I'm just going to listen to your lungs and stuff like that. I went ahead and counted your respiratory rate at 16 earlier when we were talking. Haven't noticed any labored breathing at all. Your chest depth when you breathe is totally normal. Your posture is really good, nice and relaxed. I didn't notice earlier, didn't notice a barrel chest, anything like that, any unexpected findings. Again, the synostosis in your nails, there wasn't any of that, so that indicates good oxygen. I'm just going to go ahead and examine your posterior and your anterior thorax. Good. So the muscles all looked really good. So now I'm just going to go ahead and listen for some breath sounds, and I'm going to go ahead and listen for some heart sounds too as well. So first we're going to do the breath sound. So as I move my stethoscope, you just take a deep breath in, okay?
Okay.
You can go ahead and breathe normally. Just gonna come back and I'm gonna ask you to lean forward. I'm gonna have you do your deep breaths again as I move my stethoscope, which normally I would do this underneath of her sports bra, but. go ahead and lean back. Good. Normally too, when I would have listened to your lungs, I would have went under your gown, but just didn't want to invade your personal space. Your lung sound, didn't hear any crackles, wheezes, anything like that, so that sounded really good. Flip my stethoscope to the bell. I didn't hear any murmurs at all. That's really good. Your heart sounds, I heard the lubs, the dubs. I went ahead and took your apical pulse. That was about 76, totally normal. So I'm going to do another couple tests, have you lean forward, and I'm just going to have you repeat 99 after me. 99,
99,
99,
99,
99,
99,
99.
99.
Okay, good. That's equal on both sides. I'm just going to go ahead and okay, good. That's that. I'm sorry, one more. Just gonna check for lung extension. Take a deep breath in. Out. Okay, good. So that's all totally normal and great. Like I said, no barrel chest. Your anterior and posterior thorax, the shape, the symmetry, the muscle development, it was all really good. Your lateral and anterior posterior diameter, that was good. Your breath sounds good. And then, so for cardiac, your general appearance is good. Your skin color is good. Breathing effort, didn't notice any labored breathing. I'm going to go ahead and feel for a couple pulses. I'm going to feel for your temporal pulse. Good. Carotid. Good. I feel for radial pulse. Good. And the pedal pulse. Okay. Those are all good. And like I said, that was about 78 earlier, so good. Just gonna inspect your jugular vein. Good. Nothing there. Like I said, your skin turgor is really good. The color, the temperature, everything's good. Your cap refill is really good. I didn't notice any superficial veins, any clubbing, any tenderness anywhere in your arms or any of your extremities.
No.
Good. Well, that's really all I have for you today. So thank you for coming and have a good day.